This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health today before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Give me a call at 888-630-9625. That's 888-630-9625. Love to talk to you on any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've done everything you can think of, and you've come up with the same old, same old. Guess what? No thing that works. Well, here's an opportunity for us to fix it for you without drugs, without surgery, in a way that your body can actually progress into a much stronger, healthier lifestyle. How many times do you find yourself getting hurt? Little stuff. You know, you bend over and you pick something up, or you say, oh, that didn't feel so good, or you turn quickly, or you reach in the backseat of the car, or you go through even a dental procedure or something of that nature, and you notice that you don't feel as good as you did prior to doing whatever it was that you did. And you hurt, and it goes away. You take whatever, analgesic you're going to take, you rub something on it, and it's better. And, pretty soon, over a period of time, all these little things accumulate, and you wonder, well, where did this come from? And you forget about the little traumas, the blows, and all the nonsense that's taking place over the years that you put up with and took something to mitigate, to hide the expression of the symptom process. And now you're in trouble. Now you got a problem. Well, we're going to talk about that today in depth, and we're actually going to talk about it in detail this Wednesday evening, October the 6th, 7:30 p.m. at the Roselle Center for Healing. Spinal injury prevention, or how little things grow into big, nasty buggers when it comes to spinal structural pain. And in studio to help me talk about that, one of my favorites in the office, Dr. Matthew Adams.
One of your favorites, huh?
Only because I pick on you constantly, because, and if I didn't love you, Dr. Matt, I wouldn't do that to you. But, you got a bright brain, you call me on all my nonsense on, a lot of occasions, and it's a good thing. It's a nice exchange, So my little problems don't grow into big things, and I can keep you from. Never mind.
Nice.
Now we're getting into a real, philosophical something or other. So we're not going to do that. But seriously, let's get to the program. And this Wednesday evening, October the 6th, 7:30 p.m., you're going to be talking about spinal injury problems. Not only how they show up and become big, nasty, ugly things, but how to prevent them from going to that direction. They don't have to get worse. So let's kind of pull that apart a little bit. And why do people ignore little things? That's probably a good question to kick it off with.
Because there's too many other things going on. You can't worry about this. You can't worry about the pain. You can't worry about that little soreness. It'll go away. That's usually a comment. I thought it would go away. I get that all the time. And sometimes it does go away, but at least the pain goes away. It doesn't mean that the whatever you did goes away. It'll just come back and get you later. So I think that we just ignore it because we get so busy. I mean, out here, there's stuff going on all the time. It's crazy out here in the Northeast. So it's easy to get distracted with other things and not think about yourself.
Yeah, that's right. We have to keep remembering that you're a ridge runner, from the hills of Tennessee.
We move a lot slower, so
yeah,
it's a lot easier to pick out some of the things that are going on.
You don't take things quite as seriously as we do out in the East Coast. Seriously, Dr. Matt, spinal injuries, people spend more time paying attention to their social calendar than they do to the problems that affect their physiology on a day-to-day basis. They're all worried about where they're going and what they're going to be doing and who they got to contact and, where they got to get their kids to and so forth. So there's an attitude of putting up with, if you will. And, people go to the dentist, and they know they need to go to their dentist on a regular basis to find out if they have any cavities or anything, gum disease or anything like that, well before the symptoms present themselves. But here we have the housing, if you will, for everything that works in the body. The brain, spinal cord encased in skull bones and bones called vertebrae, and out of those holes that these bony apparatus form come the nerve roots that go to the organs and the muscles and so forth. And we are subject to breakdown. So let's talk about how breakdown occurs and how we put up with, and then ultimately how we're in major, major trouble.
Breakdown occurs from all different angles. It occurs from the falls you took as a child to the car accident you had that you thought was just a fender bender and there's, didn't have any pain, which, studies show that even a fender bender at 10 to 15 miles per hour, it causes major trauma in the spine and in the ligaments.
It's actually the worst kind of injury for a car at 10 to 15 miles an hour because there's no compensation by the car.
Yeah. So, all those things that we take and we hit and we're like, well, I'll just tough it out, or, I've got to do all these other things. The problem is if we just took some time to fix it then, it's so much easier than having to wait until you break down and then you depend on so many other people and depend on other things to get you through. You get to the point where you're in so much pain that you got to have people drive you somewhere or people help you do this or that. When if you just took some time before then, you could have corrected it and kept that, the hole where the nerves go through from starting to close up, or you could have kept that disc from pushing out and pushing up against the nerve. All these things that become major problems, just take care of it sooner.
Progressive degenerative changes over a period of many years, and it's funny how just a little bit of trauma can cause major problems over time. For an example, and this goes back before your time, there was a guy by the name of Sue out of the University of Colorado. Chiropractors call this disrelationship, we're talking structural disrelationship, subluxation. Osteopaths call it spinal lesions. And they did a research project that was well funded and unfortunately very well buried afterwards. And they used laboratory animals, and what they did is surgically move the spine, the vertebrae, slightly, very millimetrically out of position. And then they monitored the animal for pain presentation and other physiological degeneration. And what they found was the weight of 2 quarters, that much distortion, 2 quarters on these animals, these research animals, was enough to cause pain, degeneration, tumor formation, lack of function, loss of physiology, the weight of 2 quarters. That's huge.
Well, it's not huge. It's small.
It is small. It is small. The effect, the manifesting is unbelievable.
Yes.
And we wonder, and this is the whole thing, we wonder where this stuff comes from when obviously the irritation to a structural segment, being the weight of 2 quarters, causing this type of breakdown over a period of time and years, and we wonder why we have the numbness and the pain and the irritable bowel disease and the heart doesn't fire the way it's supposed to and so forth. That's what we're talking about here.
And it's not even just the weight. There's also the factor of a stretch. So if something's rotated, if your hips are twisted, you've got a stretch on those nerves. And so now you're getting a very similar amount of weight or irritation like you would if you had weight on it. Or, whenever your head is leaned forward, the spinal cord connects all the way down to the sacrum. So now you're stretching the whole cord because your head is sloped forward because of your bad posture, because you didn't listen whenever you were told to, sit up straight or keep your head up. So all those things start to wear down. And then what happens is you've got pressure, and your body recognizes pressure. And it warns you. It gives you some pain, but it also adapts, and it starts to change. And so now your body, subconsciously or whatever, is starting to turn and twist to take pressure off. And then people wonder, well, how did my spine start looking like that? Well, your spine's doing the best it can to deal with what it's got right now.
See, I had indirect spinal structural encouragement for good posture when I was a kid, because from kindergarten all the way through 6th grade, I went to parochial school, Catholic school, and the nuns had these big rulers. They were very thick, and they used to beat you if you slouched or if you didn't stand up properly and so forth. But that's, I degenerated other ways other than that. We won't look at that situation. Now, seriously, the postural patterns, environmental irritations and so forth lead us to a place of either compression or overstretch, causing the nervous system not to work the way that it was meant to work. And subsequently, it's like a rheostat on a wall. It dims it down. And so we have either too much flow, or we don't have enough, or we have a block of flow, and subsequent degenerative changes over time. I want you to take this apart. Since we're on the spinal system,
okay.
You have a spinal segment or multiple spinal segments. You said that what affects the neck is going to affect the low back, and that's true. We see that thousands and thousands of times over the years that we've been in practice. But what happens? You have this small off-centering. Let's talk through that so our listeners really understand what they're ignoring, what they're putting up with by not having their spinal systems checked, or at least having the capacity to be able to do things on their own to prevent this progression. But we have a spinal segment, a vertebrae, if you will, out of its normal position. And we're talking about a millimetric aberrant positional shift or change. Take us through what happens.
Well, you have it's out of position a little bit. So if something's out of position, it's not going to move in its natural plane, because the spine is made to move and to glide on each other on the bones. And so now you don't have that movement. That movement, you get decreased signal to the brain, and the brain recognizes there's a problem. And so now it's going to go into kind of defense mode and start to tighten up some areas around it. So now you've got additional pull on one side or the other of the spine, pulling it away. And that's causing a little pressure there, and sometimes that can cause problems on the opposite side that you're having issues. And this is hard. I might have to do a better example, because I'm doing hand movements like I'm showing a spine, but
they can't see you. They can't see you. You have to verbalize it.
Yes.
Everybody's auditory right now.
So also, if you have added pressure on an area, the body's going to recognize that, and now it's going to say, oh, I need to reinforce that. Just like you have a building, and you've got added pressure on an area, you want to reinforce an area, you put more material there to hold it. And so your body does the same thing. So you start adding more material. So now we've got arthritis or bone spurs. I guess that's a better way to example. Let's say like your neck. So your neck, you have a place in your neck that's out, causing your head wants to tilt over a little bit. Well, your body doesn't like your head to be tilted. It wants your eyes to be level. And so it's going to figure out, okay, if I move the hips a little bit, that'll make the eyes level. Or I can shift the neck over. So now you've got a curve in your neck, or possibly a shifting of the pelvis due to a spinal misalignment around your neck.
It's a compensatory pattern that allows you to exist in a normal functional plane. The problem is that the disease, if you will, the degenerative arthritis, the disc disease progresses, and that's how it starts. There's 3 phases that we talk about of degenerative disc disease. And it starts with this misalignment, and even if you don't have any more trauma, unless it's corrected, over a period of years, it progresses. Let's talk about that.
Yeah, use it or lose it. I mean, if it's with any joint, your body, if it's not using it, it's gonna basically absorb it, or it's like, well, you're not using that joint, so we're just gonna kind of take away the disc and other things because we need to use material elsewhere. And so you'll have someone with a straight neck. There's no curve in there. It's not moving very well, and so now the discs start to dehydrate because you need movement in the disc to pump fluid in and out. So you start to lose the disc, and then you lose the disc, and you got added pressure, so now the body's starting to get bone spurs. And eventually the bone spurs start to connect, and so you get this like fusion of the joint over time.
In fact, it does fuse. It's an ankylosing type of problem, and there's many different phases of that in degenerative diseases that takes place. We want to get into that. We want to get into the specificity of what takes place. This is an important subject to understand, because even if you're going out and exercising, sometimes your exercise will cause an underlying problem to worsen if you're not exercising properly. And we think that just building muscles and putting a little tone in the muscles is going to help. Not so much. I want you to know that this Wednesday evening, the 6th of the month of August, Dr. Matthew Adams, 7:30 p.m. at the Roselle Center for Healing. We're going to be talking about spinal injury prevention and what you can do to make a difference, but also how little things turn into monumental problems if you ignore them over time. You're listening to Dr. Tom Roselle Live. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We've got one that we're exploring through, and it's called spinal injury problems, actually how to prevent them, but how little things grow into big things, and you don't even know where they came from. It's an important understanding because you really need to appreciate what happens when you put up with things over a period of years. August the 6th, 7:30 p.m., Dr. Matthew Adams will be presenting this specific program, Spinal Injury Prevention, at the Roselle Center for Healing, especially how you can get rid of the problems that you already have and why they're there in the first place. Love to have you as our guest at our office in Fairfax. Give us a call at 703-698-7117. That's 703-698-7117. And tell my staff that you'd like to be there. We can only accept so many people because our space is limited, and once it happens and we're full, we're done, and we don't want to send you home if you just kind of show up. So call us. Say, hey, listen, I want to attend Dr. Matt Adams' presentation this Wednesday evening, August the 6th, 7:30 p.m. Be there with us. I promise you'll learn a lot of things that you can do to help yourself. Very, very important. October the 18th, Ageless Health 2014. This is a day that if you show up and you attend and you be there with us, you will remember and be able to handle and do things differently from now to the rest of your life. I promise you, this is a day that is over the top. We do it every year. It's a full-day presentation. The information that you're going to get is unbelievable. It's based on the triad of health, structural, chemical, emotional. It's based on how you can take control of your health and the very next day implement a game plan to change everything that is bugging you at this moment in time. If you talk to people who've been there before, go to our website, rosellecare.com. That's ROSELLECARE. You'll see all kinds of information on that. Register now while you still get a discount. $79. That's all. That's it. That's nothing for a whole day. Plus, for that $79, you're getting an organic lunch as well on top of everything else. I promise you, it's a day that will blow your mind and change everything about you for the rest of the time that you have on this planet. Let's go to the phones. Ann, thank you for calling. How can we help?
Hi, Dr. Roselle. I don't have a spinal story, but in your business, it probably relates to the spine. I keep forgetting to share a success story with you when I have my adjustments. About almost 2 months ago, I happened to mention to you, only because they had said the surgery word, I'd been to my dermatologist, and I had a cyst under my arm, and he said, if it stays less than 2 centimeters, we won't have to do surgery. Oddly enough, the next day, that cyst started growing, and I thought, God, I'm going to have surgery. So I happened to mention to you I had this cyst under my arm, and you said, oh, well, let's see if we can't fix that. And you gave me an ion treatment and a laser treatment. That cyst totally disappeared. I came back from vacation, and I canceled my dermatology surgical appointment. So this morning when you were saying doing things without surgery, it was a reminder to me that I was one of those who was able to escape a surgery.
Thank you.
And underarm cyst removal didn't sound like any fun.
No, and to explain people what it really turned out to be, it was a congestion of the lymphatic system. Under the arm, there's a duct called the portal duct, and that's where all the lymph system dumps into the body. And often, because of inflammatory reactions or structural compression, irritation, it causes one of the lymphatic nodes in the arm to swell, to accumulate all this stuff. So all we did in your particular case was assist the body's ability to do what it's supposed to do under normal conditions, and so that was that, and it went away, and I'm delighted and I'm happy, and thank you very much, Ann.
And I am too, and I was also reminded, and I wanted to share with your audience, under most conditions I would have never thought to mention to you I had that, except they had said I had to have surgery, and when you said, hey, what's new, what's going on, I said, now I've got to have surgery.
Yeah.
So it's a reminder to tell you everything that's going on, whether you're involved with it or not.
Yeah, if you're my patient, let me know these things. I may tell you, listen, nothing we can do about it, but here's where you got to go to get it done. And, I'd send you the same place I'd send my family. You know, there's an old statement that I drum in constantly: mother, brother, father, sister, child. Treat everybody like you treat the people that are the closest to you and your family, and guess what? You know, you have things like this happen. Thanks so much, Ann.
All right. Have a great Sunday.
I appreciate it very much. Dr. Matt, that's the kind of thing that we see. And this woman is, you know, she's a great lady. She's a very smart woman. She gets it. She understands it. She, you know, takes great care of herself. But the body works miraculously. It works beautifully. And if we pay attention to it, we understand the physiological mechanisms that are there. We apply the appropriate intervention, if you will, not to take away from the body's ability to do something, but to assist it. We end up with things like this. We're coming up to a break, unfortunately, and we have to pay attention to the people who bring you Dr. Tom Roselle Live. We're going to get back. We're going to talk more about spinal injury. If you'd like to join Dr. Matt this Wednesday evening, 703-698-7117. That's how you do that. Love to have you always. Please be our guest. We'll be right back after these messages. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625. That's 888-630-9625. We're here for you, talking about spinal cord or spinal injury problems and that affect the spinal cord and the rest of the nervous system, but more importantly, how you can fix these things. This Wednesday evening, August the 6th, 7:30 p.m., Dr. Matt Adams, my guest in studio today, will talk to you about all these things that go from little guys to huge problems where pretty soon your balance goes, your legs are numb, your arms tingle, your shoulders hurt, and you think it's tension, or you have to put up with the rest of your life and take all kinds of medication. That just begins to make it even much more devastating in the long run. 703-698-7117, 703-698-7117. You'll go home with an applicable approach to something that may be bugging you for many, many years. Dr. Matt, before we get into a little bit more of the program, let's pick off a couple of the phone calls because people have been holding very patiently. Diane, thank you for calling. You have a question on PVD, peripheral vascular disease. What's going on?
My doctor has put me on a blood thinner, which I have not started. I just picked up the prescription, but I've had AgFib in the past, an ablation, and I'm a little bit anemic. And I'm just wondering whether I should take a blood thinner. What is your opinion?
I can't tell you yes or no, and I'm not dodging the question. Is that I don't know enough about your health. Right. There's a lot of things that, in my opinion, and this is broad brush, this is not directed to you.
Yes.
There are a lot of things that do a better job than the blood thinners of Coumadin and two, three of the other things that are out there right now. All of those guys, for the most part, cause the body to potentially bleed internally. And if you want to control the clotting mechanism, you can do that with omega fatty acids, omega-3, 6, and 9s, in the proper balance. And the reason that everybody hypes omega-3s is because in our diet, omega-6s are so high, and they actually cause a lot of oxidative damage and degeneration. But you want to balance them, and from the DHEAs to the EPAs to the ALAs, those are all different forms of those omega fatty acids. So they'd have to be in combination. Dietary control is crucial. Neurological control. If you've had atrial fib, where your heart's misfiring and so forth, often that has to do with neurological innervation to the muscle. The heart has 3 neurological sources. It has the nerves that are inherent to the heart itself, the pacemakers. It has the nerve that comes from the brain called the vagus nerve, and it has nerves from the spine, and those are the peripheral nerves. They're also called the splanchnic nerves. And if those guys are misfiring, like what we're talking about right now, then the heart will misfire. Or if the acupuncture energy going to the heart itself is not substantial, it'll be a problem. Or if you're not getting enough balance in potassium, magnesium, and some of the other trace minerals, the heart will misfire. If you have way too much calcium, the heart will contract too hard, and you'll actually go into cardiac failure, and just because the heart will go into tetany, and it just burns itself out. So there's a lot of things that you have to look at physiologically. So I'm not hedging, Diane. I don't mean to do that.
I understand. After I read the insert that came with this, and it mentioned most of what you're talking about, I was leery myself.
Yeah, it's not a good course to take if you have other options. My belief system says that most people have other options, and we're happy to help you through. Come in and see one of my docs. Dr. Matt can help you. Come to the class Wednesday night and listen to what we have to say, and and we can do some one-on-one with you and get a little bit more data.
All right, thank you.
Diane, thank you for calling. I appreciate it. Bernice, how are you, my friend?
Hello?
Hello. Hi.
Hi, good morning.
Good morning. How you doing? That's right, it is morning out by you in Arizona, isn't it?
Yeah, it's barely like 9:30 or so. I have a question about chemtrails. I see them in the skies often, and I wondered what could we do to detoxify?
Well, the same thing that you would do to detoxify any kind of chemical pollution that's out there. I mean, we're constantly being bombarded by that and all kinds of things. And if you go and you look at the information that's out there, people are going to tell you, well, it really doesn't make any difference. You've got the jets that are giving off all the condensation and so forth. The problem is that they are chemical substances that cause problems within the atmosphere, and subsequently they sink to the earth, and you're breathing the stuff in, and you're absorbing it through your body. Most every article you're going to read is going to say that there's a widespread conspiracy theory about that. Well, I like conspiracies because in there's an element of truth someplace. And, when you add this to all the other things out there, and chemical irritations and chemical warfares and nuclear exposures like we had in Japan a couple of years ago, that's affected the United States and its vegetation and so forth. And we wonder why we have all of these diseases and functional disabilities that are starting to come about or have been over a period of many, many years. There's a piece of truth to all of this. So getting to your question, how can you detoxify from this? You detoxify the same way you do everything else. You try to keep your body as alkaline as you possibly can. In our practice, we're going to use things like ionization and laser combined to pull things out of the lymphatic system. We're going to use specific nutrients. They're based on the individuality. We're going to check people for allergen patterns. We're going to check them for exposures to chemicals. The more specificity that you have, the more specific you can get in identifying these things, the more useful and helpful you can be to the patient. So, again, it depends on how much exposure you're getting. Out in your area of the world, you've got a lot of military aircraft that are flying all over the place. You've got nuclear exposures. You've got underground things. That this is not the program to talk about that, but they do exist. So start with that. Get somebody that does the work that we do. But I would start with alkaline diet. I would start with ionization, detoxification. I would start with clearing the bowel out, doing vitamin C purges and flushes, clearing the liver out, doing a liver gallbladder flush, doing those things on a regular basis. Other than that, you have to be proactive. You have to get ground roots and go after people. If you look at all of the information that's out there. There's research that is published both pro and con when it comes to the entrails. So, begin the process, my friend. It's a arduous one.
How often do you need the flushes?
If you're in an area that you're exposed, I would do it at least a couple times a year.
Okay.
Well, we can find somebody out there. There's that does what we do out in Arizona, I'm sure.
Yeah, there's some good people. Bernice, thanks for the call. I appreciate it very, very much. Lynn, how can we help you?
Good morning. I am very glad to speak with you today. I wanted to know specifically what is the difference between essential tremors and Parkinson's, and also I wanted to know what tests are used to discern which one has, if there are any tests, and number 3, is there anything that can be done to reverse either of them or to contain them?
The answer is it's a long, involved answer. However, essential tremors have to do with shaking, rhythmic shaking, and some of it is intention essential tremors. That means when you go to grab something or you have something in your hand, that's when you start shaking. It can affect any part of your body. It doesn't just have to be your hand. Your whole body can shake. It usually happens when you do simple things. You try to tie your shoes. You start writing on a paper. They also can affect your voice. You'll hear a shakiness in the voice. You'll hear a patient quiver, if you will, when they try to express themselves. They're usually, in the medical literature, they don't hold them out to be anything other than an irritation, not necessarily problematic, but they usually are a underlying predisposition or an end product, if you will, to other things that are taking place. It's often confused between Parkinson's disease and, these tremors, when they affect folks, usually affect people who are over 45, in our experience over many years. How do you distinguish the two? There's a lot of distinguishing features between Parkinson's and essential tremors. Tremors from Parkinson's disease are usually in the hands, and even when your hands are at the side or they're resting, they're going to move, they're going to shake. Essential tremors, again, are specific when you're doing something. Essential tremors don't usually cause a health problems, but Parkinson's is a degenerative condition, and pretty soon it slows everything down. You get this facial, what looks like almost like a facial paralysis. You start having a shuffling gait. Your posture pattern for the patient is one that is stooped over, and the hands are held closer and tighter to the body. So you can distinguish that way. MRIs, if you get to that place, will show some demyelination, myeloid depositions. So there's a lot of different ways of doing that, but you've got to get to somebody who can help you. Can essential tremors be helped? In our experience, if you can begin to identify the underlying problem, and we find them as a result of sometimes heavy metal toxicity, we find them as a result of past trauma and blows to the cranium, to the skull, and to the upper spinal area. All of those things have to be looked at, and if you balance that, sometimes living in an environment that has high levels of electrical input, an insult, if you will cause those tremors to occur. We've had significant success with them over the years. Everybody, absolutely not. But can you modify them? Can you help them? Can you make a difference? Yes. Sometimes it's as simple as not enough B complex and particularly something called thiamine, but that's not a broad brush. That's not for everybody. I'm just saying sometimes it can be that. Love to talk to you, Lynn, if I can help you in any way. Just give me a call, and we'll discuss it further, or come in and have one of my doctors evaluate it. We've got some good people that deal with that all the time. Dr. Matt, let's talk about that relative to spinal cord injury and how that happens. Talk us through that just a little bit.
Oh, about tremors?
Yeah. And how they can come from the subject that we're talking about.
Well, tremors, a lot of times it's an overexcitatory issue. So with a joint out of place or have a problem, not only can you get a decreased signal, but sometimes you can get an over-exaggerate or increase signal to certain areas that can cause tremors. Also, we talk about demyelination. So you've got the myelin sheath around the nerves, and if you start having problems with that myelin sheath, it can't control the amount of signal going through there, and you can get muscle tremors. Let's see, what else? There's the thing about some of these, we talk about how everything involves everything, and everything's connected everywhere. That's why, like with the first caller we had, telling you about the cyst. I mean, even if you don't feel like the cyst is going to affect something, or you're going to have surgery, you'd never know how that cyst is going to affect other parts of the body from a structural standpoint. And so, looking at the tremors, there's so many correlations between, we talk about the nerves and the hearts, and the nerves going to the intestinal tract and how you're going to absorb your calcium and your B vitamins, or the nerves going to the stomach, how much intrinsic factor you're going to make a stomach acid to be able to absorb those B vitamins to keep from having tremors. So there's so many areas in the body that if you have what we term a subluxation, where the joint is out of position, causing nerve irritation, that there's so many areas in the body that can be affected by that.
I have a headspace that says anything can affect anything and anything can be fixed or modified in some way. As long as you're breathing on the planet, there's a way to change things. The problem is that a lot of people don't want to do what it takes because it's a lifestyle process. Other than trauma and falls and things of that nature, it's things that we do. We've talked about there's only three things that can cause anything. One is injury, the other one is biochemical insult, all those things in our environment, things we eat we shouldn't, things that we need more of that we don't get enough of, the exposures to the things that are in the sky, the entrails, or the xenoestrogens and all of the additives, preservatives, and pollutions that we get in our streams and our waters, and then emotional stress, because truly the body doesn't know the difference between an actual experience and one that you think about. So we have to put that in proper perspective. Are you going to be proactive? We've if anybody's watched, and hopefully most of you have seen it, the PBS special that they did on our work 2 years ago, be 2 years in November actually, and we had 6 patients that had failed under traditional allopathic care from people who had a young girl who had a horrible problem with allergies to the point where she'd go into anaphylaxis and seizures on a daily basis, a woman who had MS, a young boy who was so off the wall ADHD he was a danger to himself and anybody that was around him, a woman who was a tennis player, top level Masters tennis competitor. Anyway, before all of these people responded perfectly, got off all of their medications, and it's because of what we did to support the body. The woman who had MS had gone from 4 spinal lesions to 25 spinal lesions in 2 months. That's how fast it was progressing. She was on tons of medications, and all we did was support the body. We did it with manipulative care, acupuncture care, detoxification, pulling the heavy metals out of her body, supporting her nutritively, and so forth. And she got to the place where she was able to live her life without any meds, I won't use the word cure with any of these conditions, but in a total state of remission. And this is what we see, and this is what happens, and what we're talking about specifically.
Well, because they're super motivated. They know what they want, and they get to the point. A lot of them, because they go to, how many times do we have people go to multiple doctors, even chiropractors, and come to see us, and we make a difference. 1, because we do some things that are different, but 2, we teach them because it's a lifestyle change. You have to change, and so a lot of these conditions, we're going to explain to you, yeah, you're going to be coming in here for a little bit, but most of the time you're going to have to make changes, to make these lifestyle changes. If you do that, you can get better. And I think that's where we miss. We trust, so many people trust so much for somebody else to do it for them, but there is a lot of choices that you have to make on your own.
We're changing lifestyles. That we take a patient and you come in and you tell me I've got this, whatever this is, X, Y, and Z, and we try to take a look at it from a platform of why is that? Why is it there to begin with? And the program that Dr. Matt is going to be doing this Wednesday evening that we hope that all of you will join us to, August the 6th, 7:30 p.m. at the Roselle Center for Healing, is on preventing these things from happening. Join us. Give our office a call, 703-698-7117, 703-698-7117. Join us. Talk to us. Talk to Dr. Matt. He'll sit there with you afterwards, and, he'll look at it from an individual point of view. We'll be right back after these important messages.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday, 12 noon, bringing you the most intimate and up-to-date information on integrative and alternative care, from chiropractic, acupuncture, nutrition, functional medicine protocols, all those things that you need to know about, didn't know who to ask. Well, here's the opportunity to ask the question. And if you need to get a hold of us outside the program, off the air, so to speak, you can go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com, and we will get back to you. If you would like to ask a question and need to speak with somebody, you can do that simply by calling the office, 703-698-7117, and that's the number that you call today and register for Dr. Matt Adams' presentation on how to prevent spinal injuries, or how little things got to big things and you could have made a difference, but what do you do about them now? This is an opportunity. Join us. Seriously, this is we do these programs for you. We do these as a gift to the community, to try to educate you, to give you the data. You have no obligation to us. Just be there. All we're asking you for is a reservation, so call us 703-698-7117. Want to also remind you, October the 18th, Ageless Health 2014. While you still can save money, go register. Go to our site. Go to rosellecare.com. Call our office. You can register on the phone as well. You'll save some extra money if you register online, so that $79, that's going to go to $99 at the end of the next couple weeks, is even going to be cheaper if you do it on the internet. So do it, but you'll be able to check everything out. You'll see the presentations. Dr. Matt will be there. He's going to do a great presentation, as he always does, and all of our doctors will be there. Sue will be there. She'll be talking on nutritional protocols. I'm going to put it all together for you. I'm going to give you a package you can go home with. How do you do this thing and make it work? Go to rosellecare.com, and to register for this week is 703-698-7117. Dr. Matt, let's talk a little bit about the program this Wednesday evening. What are you going to do? What information are people going to get? Why should they be there? Go ahead.
Well, yeah, we've summed up some different comments. I definitely want to help people understand why they got to the point they're at. So, breaking it down, how the little things can build up to the big things, and where you're at now. Showing some of the warning signs that you can find early before it becomes really bad. And also for those that have let it go, and now they are really bad, and how they can get back to that point they were before. So we're going to talk about the structural things. We're talking about some of the chemical things we have to work on, some of the lifestyle changes, and then how to maintain that, and how to keep everything in place and aligned so that you don't fall back into there. So, it's going to be really good to see what happened and why you're at the point you are, but also to take home different strategies on how you're going to help it and prevent it from coming back. So it's going to be really good. And like you said, I'll be there talking, answering questions, and I'm kind of a talker too, so you can ask me stuff after.
Never known.
Yeah.
Mm-hmm.
So it's easy for me to keep going, but there's a lot of information. There's going to be a whole lot of information, and trying to condense it for a lecture time. But hang out and chat with me, talk with me a little bit, and we'll go over some of the different things that they might need.
Dr. Matt will stay there all night long. Otherwise, he's got to go home to 3 women who will torture him. 2 little girls and a wife.
Yeah, thanks for clarifying that.
Yes.
I appreciate that.
Well, it's okay. I realize that, listen, I have to have fun where I can, Dr. Matt. But no, you have 2 of the most beautiful, beautiful daughters that exist. They're great kids. Love to see them all the time. When they walk into the office, it's like a gift.
And when you see little kids running around, you see the need for spinal injury prevention on a regular basis. It starts from that age.
It really does. It starts at that level, and it continues on, because we see our kids falling, and we see our children, when they become teenagers, getting banged up and playing sports and so forth. And then as we move on in life, all the things, we ski and we play golf, and golf is one of the most hazardous sports that exists on the face of the planet. Because we're turning, we're twisting, we duff the ball, and we hit the ground, and we do all kinds of things of that nature. This Wednesday evening, the 6th of August, 7:30 p.m., Roselle Center for Healing in Fairfax. Dr. Matthew Adams will be your host, your presenter. Please join us. Love to have you. If you need anything else, please give us a call. We're always there for you. You're listening to Dr. Tom Roselle Live, and you will again next week. See you then. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.